Okay, so we've turned our client over. Now let's do the second half of that, quarter of an hour half an hour, but quarter of an hour of it spent prones, quarter of an hour spent supine. Our job now is to work on the upper body, warm up the tissue around the top of the body, and show after that some deeper techniques. So top of the body, come across the chest plate, coming up to the neck. Now this effleurage move is important. It's a nice warm-up move, and it's important that you come up right round the back of the neck. So hands together from the front of the sternum. Obviously you're working with a female client, tail management, breast management there is really important. Come across, come round the top of the deltoids, through the neck and up into the back of the neck. Now you can do some nice moves, squat slightly, you can do some nice moves here where you just gently work either side of the neck coming up. So my hands are doing this scooping move from behind the head, going over the spine. So the spine in the middle, I'm coming both sides, which is quite nice. It gives the client, it's a nice move for working on around the occiput, on the top of the neck. You can just come in slightly with your fists there, and you're just warming up. Nothing too strong yet, just gently kind of warming up. Thumbs, be careful what you're doing with them, don't want to prod into the neck. But just that nice, you can tuck them in, that can work. I tend to have mine out, but I'm just careful that I'm not grabbing or squeezing in the neck in any way. Then we'll work on one arm. We will do both arms. I'm going to do this arm, just from the camera point of view. I want to make sure that you can see these moves. Again, if you're working with a female client, she would use her other hand to come across and support breast tissue and hold the towel in an appropriate place here, so breast tissue is looked after and doesn't become exposed. So nice effleurage move. I tend to hold the client's one hand in one, just gently the thumb. Nice effleurage move. Come up the anterior deltoid, a little bit of the breast tissue around maybe the upper trap as well, and come back down again to the elbow, forearm. You can come up from your forearm. It doesn't matter, whatever feels right. But again, this is the warming up moves of demonstrating your skills here. Ironing move, one hand on top of the other, small circles. Again, come up the outside, anterior deltoid here, really important to work on. Strongest flexor of the shoulder. Must make sure that it's really properly, appropriately sort of worked with, particularly if you get that tight shoulder issue. So both hands over each other, ironing moves. Again, onto the chest plate here, slightly, pec major. Maybe a bit slower, maybe I'm doing a bit quick, but just those nice circular warm-up moves. Again, a couple of effleurages in between. Next move, kneading. Here, just see if I can get in with the camera here, and just that nice moving slightly out of the way so you can see what I'm doing. That nice slow kneading move. Again, really get hold of upper deltoid here, and just give that a really good warm-up technique. Down to the arm again, squat slightly, look after your back, and then come back and do that nice effleurage move. Once you've done those moves, do both arms, then you can move into slightly different moves. You've got about 15 minutes, so you've got to sort of time yourself. Most of the moves for the exam are up the body from the elbow into the neck. So you're pushing the blood flow back up the arm. You can come a nice open fist, so I like this move. Use this an awful lot. I like the move through the anterior deltoid here, very important muscle, as I've already said. If you want to, you can bring the arm back out. Now I like these moves where you're coming down. Again, here's pec major, anterior deltoid, pushing down onto the breastplate, heading towards the chest. And of course then we bring in our movement moves. So this is the most common I think I use, my fascia release. You can come down here. It's up to you really. You can begin to make this move yours and adapt it to what you feel comfortable with. I like this. I like this ability to do this with one hand and then coming up the arm over the deltoid down to the chest and stretch. And you can see that fascially you're really lengthening and starting to work there on the anterior deltoid and pec major. And of course, if we're a little bit deeper, we've got the coracoid process in here, and we're stretching through and looking at pec pec minor too. So nice moves to do. So by the time you've warmed up both arms and you've done deeper work on both arms, then it's time to finish off and go through, timing yourself, thinking about those 15 minutes to do the deeper work on the neck. Now this can be, you can adjust this. I like the thinking about working on sternocleidomastoid. So remind ourselves how to find that. We drop our hands in. I'm going to do this side so that you can see really well. If I turn Mark's arm to the head to the side and ask him just to lift his head up, wow, you can really see the thickness. Here's the sternum head, here's the clavicular head, that nice wide sternocleidomastoid muscle, really important flexor of the neck. We need to work on that. So we can ask Mark just to let back. Let back again, sorry, lay his head back again. I sit the Mark's head against my arm. I'm not lifting it, I'm not taking it, I'm not holding my hand under his neck at all. Then I can do some nice work on that sternocleidomastoid. I like that open claw, my fingers there, the outside edges there. You've got some lovely set of tools in your fingers to roll through here. I quite like, as you come up towards the ear, bring your elbow out and then you can use the knuckles. They kind of sit quite nicely, so I can come out and then I can drop and really get into that sort of mastoid bone at the back of the ear where the sternocleidomastoid attaches. Upper trap, here's trapezius, comes up into the back of the neck. Again, I can come up and down here with my open fist. Try and avoid the thumbs. Thumbs, you know, you've got some good tools in your fingers. You don't need to use the thumbs. If you need to, then fine, but be careful. They get very, very easily overused. Again, elbow out, drop in. You can really come up and do some nice stretching and working here. Let the head fall over so you can get that nice stretching. What's the examiner looking for? He or she is looking for that flow, connection, attention to detail, and a sense of really taking your client on a professional massage and feeling that stretching and you understanding what you're trying to achieve with the tightness of the muscles. Once you've done both sides, I'm going to use my thumb a little bit there, just squeezing up a trap. My fingertips can come up into the back of the neck and I can really start to stretch the upper trap. Take the head slightly in my hands just to extend and stretch the neck. Do both sides and then nicely finish off with that same kind of nice affleurage stretching through. And always make sure that you finish off with those nice round affleurages so the client feels nice and looked after. Checking in with them as you go. How do you feel? Are you warm enough? Is it too sore? On that 1 to 5 scale, keep that going as a communication, and that's fine.